Doctors of Reddit, what's the stupidest thing you've had a patient come in for? Had a patient come into the ER with very mild abdominal pain. I asked when it started and he said right now. He didn't have a coherent answer when I asked how he knew to come to the ER if his pain just started now. I still don't understand what brought him in. It was an all-around odd encounter and he left pretty quickly. We didn't do anything for him. On a side note, he complained about the wait. He waited 12 minutes after he checked in before I saw him. I checked the records. I'm not exaggerating. Literally 12 minutes. 45-year-old male seen in the ER reported severe burns from boiling water all over his body. On exam he had no visible burns and had reduced his complaint to a small area on his right index finger, again with zero visible damage. He asked me for hydrocodone several times. It was one of the most obvious drug-seeking behaviors I've seen. Emergency surgeon here. Got called 2 AM because a patient demanded to see me because her daughter's farts smelled too bad. Kept a straight face. Does calling M so you can get a ride to the hospital to see your other homeless friend who is in there count? I am not kidding. This person said she had a syncopal episode, then as soon as she got to the hospital, hopped off the stretcher and said she was fine after the doctor talked to her and went to another room. I'm no doctor, but my middle-aged neighbor saw me in the hallway and he looked awful, really sweaty and lethargic. Obviously I was concerned and asked if he was okay. He said he was off to the doctor's to get his, I quote his exact words, fragile bumhole checked out as he farted so hard he thought he tore it right up. I wished him luck and watched him shuffle away. There was a guy who came to the ER because his iPhone app told him his sleep was poor quality. I used to use a sleeping app that constantly told me my sleep was poor. Screw you app. I slept like a log. It was 3 AM and I'd been on duty in the emergency since 8 AM. I was exhausted. A well-dressed man came in with his 8-year-old, healthy-looking son. I asked him what was the problem. He said, well, I was at a wedding and it occurred to me that my son is a little short. Can you give him something right now to make him taller? You went and brought out a stool, I hope. Whilst working as a GP, primary care physician, I had a 40-ish-year-old man come in with his wife complaining of electric shocks for the past year. It quickly became apparent these were static shocks caused by his cheap work suit and rubber-soled work shoes. I explained he just needed to change his shoes, and it would stop, but both him and his wife were baffled. They'd never heard of static shocks and couldn't understand why I couldn't treat his condition. Unfortunately, I have no power to change the laws of physics. I work in a burn unit. Had another hospital fly, yes fly as in $50,000 helicopter ride a patient over. Patient ended up having what looked like a bad tan on a small portion of their body. There were a couple little blisters on their leg, and they wouldn't stop screaming for pain medication and claiming that they were in 12/10 pain. Fairly sure that Sendinger was just trying to dump them on us. Fairly sure that Sendinger was just trying to dump them on us. More than $50,000 helicopter ride. That's a very expensive way to get rid of somebody. Paramedic here. Had someone come into the ER because they were gay. The stupidest thing I've been to the doctor for. I took my young son in because he had a very regular rash on his lower back. It wasn't until I was in the doctor's office that I noticed that it had exactly the same pattern as the inlet cover on our jacuzzi, which he had just been bathing in. Not a doctor. Dated one who told me she had a patient who came in with his wife that every time they had sex, his mouth went numb for a little bit. It confused the heck out of her, so she had them both walk through their routine. It seems his wife was using a spermicidal film just before they started every time and he was going down on her. You'd think they would have eventually figured out to reverse that order. My mom took me to the ER once because she thought I had blood poisoning, which is a totally serious condition. What I actually had was fruit punch earlier in the day, and it dripped down my leg. The nurse wiped it off, and I was saved. Not a doctor, but worked in an ER for several years. There was certainly a bit of cynicism that is probably prevalent in many similar settings. We'd get people bringing their kids in for hangnail or split ends on their hair. No, seriously. The inverse, however, was that sometimes you could not be too cynical as it could have been a big deal in the end. I remember one time a Haitian family came in and most of the staff would roll their eyes when Haitians came in because their English was typically terrible and they would not be able to convey what was wrong. In most cases it was something like baby has sniffles or constipation, not really emergencies. This particular family brought a teen who claimed his eye hurt. Between the language barrier and the complaint, most people just shrugged and said, yeah, okay, whatever. Turns out the kid got a CT scan that showed worms basically eating his brain. I don't remember the outcome, but the doctors guessed it was poorly cooked pork. To be honest, not sure if the kid even lived or not. Sounds like neurocystic, more commonly seen in folks from Latin America and the Caribbean. Fresh graduate from medical school here. I did my internship in a public hospital in India and have had my share of experiences with people from remote, rural areas. Once we had a lady brought in for attempted suicide. The pills she took, stilbestral tablets meant for inducing ovulation in their cow. She figured if it's medicine for cows, it must be toxic in humans and downed a few. Another time we had a mute patient, also bedridden since a few years, brought in by his brother following trauma. We suspected a pneumothorax, which is when air gets into the lining of the lung and can dangerously compress the lung tissue and compromise air entry. Asked the brother to get an X-ray done. When he brings in the film, it's suggestive of COPD, which does not correlate with the clinical findings at all. Only after several rounds of questioning did the brother pipe in that he had gone and gotten his own X-ray taken, instead of the patient's. Families who forget that the patient is HIV positive or has active TB. Women who genuinely have no idea how they got pregnant. New mothers who push their newborns to sepsis by feeding them unpasteurized cow's milk right out of the packets. The list is long. It's more sad than funny, and the huge inflow of people in public hospitals don't give us the luxury of educating the people who need it the most. A nurse here. I have a million of these. This is my favorite in recent history. A woman checked her 9-year-old son into the ear because he was upset he didn't win an award during an academic award ceremony at school. She wanted someone to talk to him or something. I can't deal with him. She basically wanted us to parent her child for her because she didn't want to be bothered. I'm a medical assistant. Not the most stupid thing ever, but we had several women come in to get tested for a UTI because they were peeing blood. Some of the first questions we ask are you feeling any pain during urination and have you recently had beads? 9/10 these women didn't have a UTI and remembered eating beads. So sometimes eating beets will turn your pee and or poo red, but it's not the color of blood. I also knew a lot of pharmacy students and they were also told to ask the patients to demonstrate how they were applying or taking medication if the patient said it wasn't working. The anecdote in their textbook was about a teenager who became pregnant even though she insisted she used contraceptive jelly. She was spreading it on her toast. And that reminds me of another time. This woman came in and said the syringe for her baby's liquid medicine wasn't working, so we asked her to demonstrate what she was doing for us. She sticks it in the bottle, turns it upside down, and says, "See nothing. You have to pull the plunger, lady." I was your patient one last night in the air. I've been having periods for 34 dang years and it's never ever been early. It started in a way that was highly unusual. Needless to say, I was mortified when a few hours later, it became more obvious that I was menstruating. I wanted to apologize for being dumb, but I slunk out of the ER quietly, and with a great deal of shame. Only work for pathology as a science nurse, not a registered nurse. Foreigners often thought I was a doctor. After a blood test they would say, "Thank you, doctor," used to make actual doctors mad. For good reason. One day a guy came in and I asked for his referral. He said he wasn't here for a blood test but wanted to tell me he thinks he is pregnant. His wife told him to find a female doctor, me, during his pregnancy. I tried my hardest not to laugh. He was so serious. He had broken English, but he explained all his symptoms and showed me his swollen belly. I told him I wasn't a doctor and took him down the hall to an actual doctor. The doctor let me stay while he explained to the patient he wasn't pregnant. The patient was convinced he was and wouldn't leave until they did an ultrasound, which we didn't do at the medical center, and he would need a referral to have one done. So the doctor had him do a on-the-spot urine test which showed negative. The patient was still convinced he was pregnant. The doctor asked if he was ever female. He said no, I think, but I'm not 100%. The doctor ended up writing him a referral to the woman's hospital to have an ultrasound. I have a PhD. One year my employer's health insurance company gave me a card that said, not Mr. Blacksburg, but Dr. Blacksburg. I was never treated so well at the clinics. My friend is a doc of the year. She told me about a guy who came in and was blue all over his body. He was freaking out and trashing the place in pure panic. Turned out he had bought new, blue bed sheets and they colored him blue. Dabba dee dabba die. I was a volunteer first aider for 10 years. I was on duty at a local judo competition. I was on edge as there was always at least one serious spinal injury. So I was walking around the mat, waiting for the call to rush in and help save someone. And this woman started screaming and crying. I ran over, as fast as I could, jumping over rows of chairs and ready to help. She was screaming because her baby's first tooth had come through and she didn't know what to do. She asked me to cut out the rest of the teeth so that she didn't have to deal with teething anymore. Nope. Not a doctor, but I create accounts for the doctors and nurses to use in the air. I work right next to the ambulance bay and I see all sorts of random crap. Some chief complaints I've witnessed, being hungry, faking seizures, terrible attempts, too sleepy, a paper cut, no complaint, slow walking, obesity denial, no money, poop is too smelly, loose tooth, too much earwax, an entire family checking in for a possible cold, a pimple, too hot outside, too cold outside, too bright outside, too dark outside, too noisy outside, evading police brutality, eventually arrested during visit, forgot where she lived, a legit concern but stupid as frick. A guy came in with a freaking pitchfork impaled in his thigh. He and his friend was jousting on skateboards. V91.07XA, burned due to water skis on fire, initial encounter. Vaginal discharge. Did the pelvic exam. White clearish discharge. I looked at the sample under the microscope and see sperm swimming around. Asked her when last she had sex. She says last night, which is when the symptoms started. Sigh. To be fair, they don't teach you in sex ed that the semen comes out of you after sex. I was pretty surprised the first time it happened to me. Not a doctor, but I was a nurse's assistant and a kitchen staff member came in and said help. I ate raw corn. Apparently the cook had convinced him that eating raw corn was poisonous or something. I had a good laugh about it. A woman came in for a baby check with her 6-month-old and she had what looked like chocolate milk in the baby's bottle. So he started explaining to her as kindly as he could that she shouldn't be giving her baby chocolate milk. At which point she interrupts him and says, "Oh, that isn't chocolate milk. It's coffee. He just loves it." I hope I'm not too late. I have a friend that works in a doctor's office in Amish country in Pennsylvania. They had an Amish couple come in, saying that the wife couldn't get pregnant. They ran a couple tests, and everything was coming up normal. So then they gave him a cup and asked him for a semen sample. He came back with it full of his pee. He had been peeing his wife, thinking that is how you impregnate someone. OMFG. Sex education equals major key people. When I was 18, I was the idiot. I'd found a big, hairy spider in my apartment. Tried to squash it but it got away. I couldn't find it again and also didn't sleep well for the next few nights because I was paranoid about the same spider lurking in the dark, somewhere in my crappy apartment. Then I woke up with what looked like a spider bite. So I start googling spider pics and become convinced that the spider I saw was a brown recluse and now I'm going to die. As I'm reading about brown recluse horror stories, I am getting a headache, feeling hot flashes, and start feeling nauseous. I actually called 911 and I cringe so hard thinking about it now. But they took me to the ER where I waited for 14 hours to be seen and by that time I'd slept off my brown recluse bite symptoms to the point that I couldn't even remember where the bite was supposed to be. The ironic thing is that now I work in healthcare and when people like this come into the ER on my shift I'm actually happy to have an easy patient to deal with, all things considered. Had a young man come into my scribe, not doctor, one day complaining of dental pain. His wisdom teeth were coming in and turns out he had tried to cut them out with a steak knife. He was confused as to why this hadn't made his pain better. When I asked why he hadn't gone to his dentist to have them removed, He said something along the lines of, "I'm really scared of needles, because a freaking steak knife is less imposing than a needle." You've been visited by the good sleep capybara. Upvote within the next 5 seconds and you will be blessed with cozy and restful sleeps. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day you magnificent people.